Latino men, do you know your risk for heart disease? What about for a heart attack? Certain traits and lifestyle habits can increase your chance of having a heart attack or heart disease. We call these traits and lifestyle habits risk factors, and they're not the same for everybody. Hello, and welcome to House Calls. I'm Dr. Eduardo Sanchez, Chief Medical Officer for Prevention at the American Heart Association. Your gender, your age, and even your ethnicity can all affect your risk of having a heart attack or heart disease. So if you want to reduce your risk, you need to know your risk factors. With me to talk about how Latino men can reduce their heart health risk is Dr. Carlos Rodriguez, Professor of Medicine and Epidemiology at Albert Einstein College of Medicine in the Bronx. Dr. Rodriguez, welcome.
Thank you, Eduardo. It's a pleasure to be here.
Let's be real. A lot of men would rather not think about their heart health risk. We prefer to think we're invincible. But you talk about heart health with a lot of men in your practice. What do you tell them about risk?
It is so important for men to know their brain and heart health, and also their risk. I am very fortunate that in my practice, I do see young men, middle-aged men, older men, and I'm very glad when a young man or middle-aged man comes in and just wants to know their heart risk.
You know, some people might think, why do men need to worry about their heart health differently than anyone else? What's unique about men when it comes to heart health?
We are so responsible for so many things. Our families, our loved ones, our jobs, and other things that we frequently will put aside our health. But that's not a good thing to do. Cardiovascular risk, heart risk, is much higher in men than in women. Risk of a heart attack, risk of a stroke, risk of heart failure is much higher in men than in women. Men really do need to come in. They should not feel embarrassed or silly for asking, because as a doctor, I appreciate it so much when a young or middle-aged man comes in and wants to know their heart risk, their stroke risk, and how they can improve it.
I know a lot of Latino men find themselves in that sandwich generation. They're taking care of their kids and their parents. And in a lot of cases, they've inherited heart disease risk from their father and their grandfather and are now passing it down to their sons and daughters. In fact, research suggests that between 40 and 60% of someone's likelihood of having coronary artery disease can be attributed to genetic factors. So how much should men worry if they have a relative who's had a heart issue?
One of the biggest, most consistent risks is family history. Unfortunately, some people do not know their family history. And it's one of the questions that comes up whenever somebody comes in for a checkup. But if you do know your family history and you already know that there's a history of heart attack or stroke or any type of disease of the arteries, then that means that you should get yourself checked. Now, having a family history doesn't mean that you yourself also have that history. It's not always passed down, but you're not gonna know unless you go talk to your doctor.
That piece is so important. So I wanna say it again. Heart disease isn't always passed down, but you won't know unless you talk to your doctor. Now, when it comes to reducing those risk factors, we know that physical activity is really important for heart health. But people often struggle to get enough physical activity. What do you say to your patients to encourage them to be more physically active?
Physical activity can be a challenge, and really, you want to find out what works best for you. How can you best be active? And it's individual for everyone, so I don't try to do one prescription for everybody. For me, I like walking. I play golf, and when I walk 6 miles, 7 miles, and this is something that really fulfills the physical activity requirement for me and helps to keep me active. And if I do not walk, I feel it. I mean, yes, I also like to dance. What can I say? I'm Latino, I love to dance, but unfortunately, I don't do that regularly enough to call it my physical activity.
Well, I'm with you on the dancing, Carlos. Whenever my wife and I find an opportunity to go someplace and see live music and dance merengue, we are there. I appreciate that you talk about it as physical activity, because sometimes I think thinking about it as exercise can seem intimidating. But physical activity can be walking, working in the yard, just doing everyday things that get you up and moving around, and that can be a better way to think about it and get it done. A lot less intimidating than exercise. I also want to ask about eating healthy, which is another thing I think most people know is important, but isn't always easy.
I think we've all had this experience, or many of us. Particularly growing up in my culture, I was exposed to bad diet, some unhealthy things. What we eat is very cultural. So a dietary recommendation has to be tailored to the culture. But it really starts with being educated about what is a healthy diet, and then also learning and having conversations about how to make your diet more healthy. What are the ingredients in the foods that you eat? How can we prepare foods healthier? How can we still eat our same cultural diet, but made healthier and in a healthy way? Baking instead of frying, reducing or avoiding red meat whenever possible.
Those are really great points. I mean, we don't have to give up our favorite foods. And for me, that is definitely plantains, plátanos. We just need to think about emphasizing the healthy parts of cultural diet and eating less of those foods like fried foods, processed foods that are less healthy. So there's one more thing I want to ask about, and that's mental health and how it connects to heart health. I know from personal experience that Latino men often find it hard to talk about their own mental health. But it's so important to talk about, not only for its own sake, but because it's connected to heart health. So how do you talk about mental health with your patients?
Mental health is a topic that I broach with my patients because a lot of times I think people don't realize that mental health can be connected to heart health and brain health. And there are many times when I'm seeing a patient who has cardiac symptoms, yet their mental health is really in shambles. And I take that opportunity to make that connection. Yes, we're gonna work on your cardiovascular health, but you also, as a patient, need to address and be aware of your mental health, because your mental health can affect your cardiovascular health. And sometimes if you work on the cardiovascular health or fix the heart without addressing or at least having a conversation about mental health, the patient may be right back where they started several months down the line.
That's a great perspective, Carlos. Thank you so much for sharing your expertise and some of your real-world experience with patients.
Thank you.
Let's recap some key takeaways. First, talk to your doctor about heart health risks. Find out if there's a history of heart disease in your family and write down what you learn so you can share it with the next generation. Next, get active. Explore what works best for you and work it into your routine. And physical activity on the job, that counts too. Next, you need to eat healthy, but you don't have to give up the cultural foods you love. Find ways to make your favorite foods a little healthier, like baking instead of frying, and cut back on those foods that are less healthy. And finally, remember that mental health is an important part of heart health. If you work on cardiovascular health without also working on your mental health, you may find yourself right back where you started a few months down the line. If you have questions about health conditions, I'd love to hear from you. Comment below, hit subscribe, and join me here next time for Answers You Can Trust.